The medical industry has seen many changes throughout history when it comes to treatments and procedures. Often, products weren't tested properly and used on patients based on weak theories. The treatments could often be worse for your health than the original ailment. Having a rod put up your privates to cure hemorrhoids, heroin for a child's cough, and electric shock therapy for impotence are just a few examples of abnormal medical treatment. Keep watching to learn about more of the ridiculous treatments offered throughout history. Number 1. The cure for hemorrhoids. A hot poker. As if it's not bad enough to have a pain in your backside, the solution to the problem was much worse. When religion was trending back in medieval times, there was a patron saint for everything, and that included hemorrhoids. Saint Fiacre was a monk from Ireland, and if you didn't pray for him, you'd inevitably suffer from hemorrhoids. It would be much easier to pray for prevention than deal with the cure, which just so happened to be a hot poker. If you did get hemorrhoids, you'd be sent off to the monks for the cure. This involved a poker that was red hot from being submerged into a fire where the monks would singe the affected area. If you didn't have the stomach for this irrational treatment, there were some other options to try. One of the treatments was to sit on the rock where St. Fiacre had sat to rid himself of his own personal battle with hemorrhoids. It's unknown how long one would have to stay on the rock to benefit. Decades later, it was discovered that bathing in a warm bath was helpful. Imagine the patient who opted for the red-hot iron finding out a bath was just as helpful. Number 2. The golden age of the enema for youth. A clyster, or enema, was trending in the 16th century. Enemas were considered a liquid remedy that would be administered up the colon by use of a clyster syringe. In medieval times, it was a hand-powered piston pump with a plunger inside the tube. The opening was threaded so different nozzles could be attached. This would direct the flow of the liquid. The original form of the enema was found in Africa and was made of bamboo. The high class later on would use clyster syringes made from silver, pewter, or ivory. It was in the 1600s that the golden age of the clyster existed. During the reign of Louis XIV, from 1638 to 1715, he promoted enemas, stating that he had done over 2,000 enemas and would hold court while having an enema. It became popular among the elite with the belief that it helped to purify the body and keep patients young. Some would have up to 4 enemas on a daily basis. Enemas can be useful, but there are complications that can arise. If an enema was administered incorrectly, it could damage the tissue in the colon and cause bowel perforation. They would have needed to be properly sterilized as well to prevent infections. Back during the time where enemas were all the rage, proper practices weren't common, so there were risks to using it. However, for vanity's sake, the elites made this a common practice. Number 3. The cure for hysteria. The first ever vibrator. The first ever vibrator was conceptualized and realized by 19th century doctors for the acute disease that only females caught, hysteria. Hysteria was considered something that a woman could catch, and the relief was the vibrator. Doctors believe that hysteria caused symptoms like anxiety, irritability, insomnia, nausea, sexual desire, and stomach bloating. These are common symptoms that most women feel on a monthly basis. The condition was considered to come from a very old medical theory known as wandering wombs, where a discontented uterus was the cause of women contracting the likes of hysteria. The treatment for hysteria based on symptoms was a pelvic massage that would induce an orgasm. At first, Victorian doctors had to manually massage the women, until Dr. Joseph Mortimer Granville created the electromechanical medical instrument. It was quickly nicknamed the manipulator and allowed female patients to give themselves the at-home massages that would cure their wandering wombs. Number 4. Cocaine, the cure-all drug. Until it was known that cocaine was highly addictive, there were many different medications that included the substance as a main ingredient. In the late 1800s, it was believed that cocaine would alleviate symptoms caused by bee pollen. Scientists were able to isolate the active ingredient in the coca leaf, which would later be known as cocaine. Pharmaceutical companies rapidly started putting cocaine in many drugs, It was a fast-acting, reasonably priced stimulant. However, Dr. George Frederick Laidlaw, a pathologist of the homeopathic school in New York, was quoted as saying, "If you can't cure it without cocaine, you'd better keep the hay fever." Despite what qualified doctors were saying, there was a lot of contradictions surrounding this new drug. In 1884, Carl Koller, an Australian ophthalmologist, found that a cocaine solution could be used as a topical anesthetic. He tested this on a patient's cornea, causing the eye to become immobile and desensitized to pain. It also caused less bleeding in the area where the incision took place. With less bleeding, eye surgery was less risky. This news traveled quickly, and cocaine started being used during eye and sinus surgery. It was marketed as a treatment for a gauntlet of maladies including toothaches, depression, lethargy, sinus issues, alcoholism, and impotence. It was sold in various forms including tonics, powders, lozenges, and in cigarettes. If you were to look back at a Sears Roebuck catalog, you would see brands advertising cocaine products as home remedies. Allen's cocaine tablets could be purchased for 50 cents a box, offering relief of hay fever, problems with the throat, anxiety, headaches, and insomnia. Later on, it was found that this wonder drug was causing a lot of the ailments it was meant to be the cure for. Cocaine caused sleepiness, appetite issues, depression, anxiety, and came with the addition of hallucinations when taken for long periods. By the early 1900s, there were over 200,000 cocaine addicts in the US, and eventually the product was outlawed. Number 5. Cornflakes as an anti-masturbation tool. J.H. Kellogg was the creator of the Kellogg's cereal brand. He created cereals with health in mind, as he was a medical doctor and activist for health. His products were designed to help Americans improve their digestion. His view was that a diet centered around bland foods would lead Americans away from sin at the time. As part of his health movement he called biological living, he released cornflakes to prevent the urge to masturbate. It was considered a sin back in the 19th century to pleasure oneself, and that a healthy diet was one way to prevent the desire to masturbate. It was never proven that this cereal by Mr. Kellogg was effective. John Harvey Kellogg ran a health resort to treat diseases and ailments with things like hydrotherapy. As a vegetarian himself, he worked with his brother William Kellogg to invent products like peanut butter and meatless meats. Number 6. Heroin as a cough suppressant. In the late 1880s, heroin, also known as diamorphine, was introduced as a safe, non-addictive substance, far better for you than morphine. Heroin was originally created by a chemical researcher named C.R. Alder Wright in the 1870s. However, it wasn't until a chemist working for Bayer Pharmaceuticals found Wright's paper that it was brought to market. Studies found heroin to be 5 times more effective than morphine and far less addictive. Bayer advertised their aspirin product laced with heroin in 1898. They marketed it towards children with a sore throat and cough. Doctors started to notice a trend of returning patients coming to get more bottles. Kids and their parents at the time were forming serious addictions to their cough suppressants. Bayer had their medicinal heroin product on the market until 1913, and in the 1920s it was completely banned by the FDA. Number 7. Shock treatment for erectile dysfunction. Erectile dysfunction has been known to occur through various causes. Throughout the centuries, various cures have cropped up. Victorians said that dysfunction was a sign of man's moral weakness. By the 19th century, impotence was believed to be caused by too little or too much sex and masturbation. In a book written by surgeon Samuel W. Gross, Practical Treatise on Impotence, Sterility, and Allied Disorders of the Male Sexual Organs, he would write, "Masturbation, gonorrhea, sexual excesses, and constant excitement of the genital organs without gratification was the cause of impotence." During that time, doctors had bathtubs filled with electrodes that were believed to restore sexual desire in just 6 sessions. Another approach was rods with currents being placed inside a man's urethra. This treatment would last between 5 to 8 minutes and would occur up to 2 times per week. As doctors were using shock treatment for impotence, Products were created with the same theories and added to the marketplace. Men could buy electropathic belts or electric belts. Ads would state that these products were designed for weak men, those that could not control their sexual urges or didn't have enough sexual urges. Companies would state that not only could their products help with impotence, there were also claims that they could cure sciatic nerve problems, headaches, nervous exhaustion, and kidney issues. There are still studies in modern times that state a low-energy shock wave can help cure erectile dysfunction, a much less harmful experience. Enough studies in modern times have also identified it's a physical and mental issue, so a patient should also consider addressing mental issues associated with impotence. Thanks for watching another show of History's Weirdest. Don't forget to like and subscribe. Cheers!